Basically, if somebody have a PIH, it's good to use azelaic acid because it helps to reduce their pigmentation as well. Okay. Right, so next tetracycline group, okay, it's called sericycline. Okay, so I think maybe in the next few years it will come to Malaysia. Apparently they say it's more effective compared to the others. Okay, so it's sericycline. Okay, so in our new CPG, we're going to review whether it is actually more efficacious compared to the others. So say if you give Doxy the first round, it works, and then you stop and the patient relapse again, you can always start the same antibiotic again. Okay, so better start the same antibiotic, okay, but try not to give continuously for more than 6 months. Okay, so you have to dilute it. So dilute 1 in 4 or 1 in even 8, okay, to get a concentration of 2.5 to 5 milligram per ml. So you can inject over the cyst area to shrink the cyst. Okay, so it works quite well for cystic kind of acne. Atrophic usually occur on the site of injury, okay, but keloid usually it goes beyond the site of injury, or if you have a surgical scar, if you see like one nice line, it's a hypertrophic scar, but if you see like a track line, okay, it's or even thicker beyond the scar area, then that's a hypertrophic scar. Defined like this, and it tends to occupy a larger space. Okay, so this is lentigo. Okay. Everybody will sleep, including me. Melanoma. Okay, this is superficial spreading malignant melanoma. Okay, so this is not lentigen. Pigmented patch on the left cheek. What is this? Melasma. Yep. Okay, so this is okay. So papule is defined by a lesion less than 0.5 centimeter. Okay, so you can see whitish and skin-colored papules on the eyelids. Any idea what is this? Benign dermal skin lesion? This is shringoma. Have you heard of this? Yep. Okay. So shringoma is a benign adenoma of acrine ducts, usually in women. So it's either skin-colored or yellowish or white firm papules. Well, so if you see any red patch, it does not mean eczema only, okay, or psoriasis. Okay, so if you've given topical steroid, it's still there, or it becomes bigger or more scaly, you have to suspect Bowen's disease. Okay, so basically BCC, SCC and all that, it tends to occur on a exposed area, okay, and usually on the face, okay, but sometimes it's quite tricky to do a surgery, for example, on the nose, near the eye, because you don't want to remove too much skin and damage the structure. Okay, so most micrographic surgery, what is actually done is they will remove bits by bits. Okay, so they remove and then they examine under the microscope to see whether the margin is clear or not. And then if it's not clear, then they go back again and remove the margin until the margin is clear. Okay, so basically it's a tissue sparing kind of surgery, a surgical method. The center that used to do this is UMMC. I think they're still doing it, but the numbers are not very high. So at the moment in Malaysia, only UMMC. And I think there's a doctor, another private dermatologist who's also doing it in his center. Okay, so not many centers offers this in Malaysia. But if you can't remove it via surgical procedure, then radiotherapy can be an option, and the rest. Okay, imicomod can also be used for superficial BCC. Prognosis usually good. Okay, especially if you treat it early, you remove and the margin is clear. Normally, if that occurs, they have left the lesion for like more than 10 years. Okay, because it's very slow growing. If they come present to you within the first or 1 or 2 years, it's usually still very small and easily excised. Okay, more than one color. You see darker brown, okay, there's even black, light brown, okay, so not so light brown, okay, so there's at least 3 colors here, okay, so those are the clues for malignancy. And A, B, C, D diameter more than 0.5 centimeter. And E, evolution, okay, it probably started as a small patch, it becomes bigger for the last 6 to 12 months, okay, so those are the history that you should be getting from patient. So when there's nodule on top of a pigmented lesion, okay, so this is very suspicious of malignant melanoma. Acral lentiginous melanoma, acral means, limbs, okay, so you get melanoma on the hands or on the feet, but hands not so common, okay, so we see the melanoma occurring on the feet. It's common It's not just pigmentation. Okay, so if patient said, oh, I got some black lesion on the feet, okay, always examine. It could be just viral wart, because viral wart also looks a bit pigmented, isn't it? But we don't want to miss acral lentiginous melanoma. It's quite nice. It doesn't extend beyond the nail area, isn't it? But if it extends beyond the nail area, so that's called a Hutchinson sign. That's what's happening here. Okay, the other, for example, okay, Indians, okay, so they tend to get also hair on the upper lip. Does not mean you have hirsutism, okay, it's associated with a certain race as well.